back to the Rehab for Runners podcast. I'm your host, Dr. Lisa, and today we have another doctor of physical therapy. Welcome, Kate.
Hi, thanks so much for having me, Lisa.
Yeah, thank you for being here. And for those who don't know you, because I know I've been following you for a while, can we start by you just introducing yourself?
I'm Kate. I am a physical therapist and run and strength coach, and founder of the Running DPT LLC, where I work with runners from all over, helping them find the joy in running again and learn how to incorporate strength training and balanced training so that they are able to participate in the sport without exacerbating their chronic illness. So initially, I started with coaching runners in general, but over in the last year, I have shifted towards working with runners who are living with chronic illness, as this is my own experience. And I have found that this is an underserved population of runners within the community.
Yeah, definitely. And thank you for sharing that. I feel like if, a runner has a chronic illness, it's very niche, but it's also probably very frustrating when you're going and seeing a bunch of healthcare providers. So, how did this all come about? Because you said it started with your journey. So, how has your journey progressed, or how did everything start with your journey with chronic illnesses?
Absolutely. So I have to kind of take it way back. So when I was 17, I developed chronic migraine. So over 10 years ago. And I was really lucky back then because, still being a minor, I was on a really good insurance with my mom, and she was an incredible advocate for me. So I was able to receive diagnosis and treatment relatively quickly. And I was really well managed throughout college. I had, maybe around 2 migraines a month. And, this allowed me obviously to go through school and graduate school and become a physical therapist. And then when I began my career, I actually experienced a couple bouts of COVID, which may or may not have played into, the development of additional symptoms. So I began experiencing worsening joint pain, more hypermobility, which I have always been hypermobile my whole life. I've had issues with, my shoulders popping out and just a bunch of different things. But I also started developing things like more anxiety, shortness of breath, racing heart rate, fatigue, like just significant fatigue. And because of my background as a PT, and I'm so lucky to have a level of medical literacy, I was able to do a lot of research and really kind of start to figure out what might be going on with me. And I ended up finding that I have hypermobile Ehlers-Danlos syndrome, which is a genetic condition that affects your connective tissue. So I have had this forever, but it is something that I didn't know I had until a couple of years ago, or a year or so ago. And I was also diagnosed with POTS, postural orthostatic tachycardia syndrome, which is often comorbid with hypermobile Ehlers-Danlos syndrome. So I was really lucky to be able to find a specialist in the area that diagnosed me. And he also connected me with a plethora of other providers. As you know, connective tissue is everywhere. So it affects, multiple systems in your body. So, being able to receive that diagnosis, it was probably within 8 months to a year of me experiencing these heightened symptoms before I really kind of had answers. And that sounds like a long time, but on average, most people wait for like 7 years before they get a diagnosis. And, things like insurance, the cost, and, appointment waiting lists, they all slow us down. I know a lot of the EDS clinics and POTS clinics have over a year waiting list right now.
Oh my gosh. That
Yeah.
is wild, because if you're running,
Mhm.
I've one of my friends in PT school had pot, so I'm a little bit familiar with it, but I know that that can severely affect not just, obviously running, but even just doing day-to-day activities. So can you explain a little bit, you already said what POTS is, but like what were your symptoms, signs and symptoms with
Yeah,
POTS?
absolutely. With POTS, it was it was, so I don't personally pass out. So a lot of people, basically what POTS is, it's a neurological condition, but your symptoms, a lot of the symptoms are, cardiac based. So a lot of people, think of that when they think of POTS. So the standard symptom is when you stand from like a laying position or seated position, your heart rate increases. And you have tachycardia, so you're supposed to increase more than 30 beats per minute upon rising and sustain that increase. Some people experience where they will actually pass out. Other people only experience pre-syncope, so those like pre-passing out symptoms, and that's what I experience personally. So for me, I will feel really dizzy and lightheaded. I will, kind of grab onto furniture when I'm walking to try to stay upright. I'll lose spots in my vision, black vision, things like that. Um, and then with Ehlers-Danlos, I have, you know, uh, widespread joint pain and hypermobility. I wear braces for my thumbs sometimes and things like that. And, a whole host of different things. One of my major symptoms being migraines, which are connected and often comorbid with Ehlers-Danlos. So, personally, especially on the POTS side, I have been able to make a significant improvement in my symptoms just through self management and lifestyle changes. And that just includes uh, drinking a lot of water and consuming a lot of sodium. This is not medical advice, but my own instructions are to consume 7 to 10 grams of salt a day, which is a lot. So, like for you runners out there, like if Trace Minerals, like 1,000 milligram sodium packets, I have like four of those at least a day.
Wow.
Yeah, so that has certainly improved my symptoms to a point. I was essentially like bedridden some days, and I'm now at a point where I'm on a walking program and able to mostly go through my day without POTS really getting in the way. I'm also on medications as well, but I've been able to really improve my symptoms there, which has made a world of difference.
Yeah, definitely. And I mean, this is bigger than just your running journey, obviously. Like, this is your health. This is how you know, your quality of life, how have these relationships with people. So, I was listening to this and I was like, wait, I get migraines. Wait, I'm dizzy at times. And you might be thinking the same if you're listening, but it's more so there's probably a pattern to, you getting these symptoms frequently versus, oh, I actually was just dizzy because I'm really dehydrated or I haven't eaten. And there's more of a pattern when you have POTS or ED where I'm sure, as you can talk about, but it's not just like a one time thing like every other month. This is
Yeah.
like to the point where it's really affecting your life.
Yes, and that's the thing with chronic illness is that it's something that, is like it's not going to get better. There's no cure. Well, I mean, I shouldn't say that. You can improve your symptoms, but there's no cure. I'm not going
Mhm.
to just wake up one day and like be completely healthy and not have any issues ever again. But that was certainly something like in the beginning that I was, experiencing some of these symptoms and I'm like, is this just is this just my body? Is this just normal and my body just does weird things? I made a lot of excuses for myself like that, like, oh, my body's just weird. And I think back to PT school, when we're doing, labs and things like that. I was always the show pony for hypermobile joints. Like, oh, look how Kate's shoulder pops out of its socket and things like that. So, I was like, somewhat aware that things might have been going on, but it wasn't to a point where it was like clinical in nature where I would it, over the last couple of years it's gotten to the point where I'm like truly symptomatic and it truly affects my day-to-day life to a point where I actually don't work full-time anymore. That is one of the things that I actually had to walk away from my full-time job as a PT. And looking back, going into coaching online was truly the best thing that I ever could have done for myself. It allows me to, work somewhat in the field adjacent and, with clients that I've always wanted to work with. As a lifelong runner, I've always wanted to work with runners. Um, and, I truly don't think that I would have been able to physically handle like all the manual stuff with my joint hypermobility and things. Um, and, being on my feet all day. Pacing is something that's really, really important to my management. And, being able to be really flexible with my time has been huge. And I also acknowledge that I'm incredibly privileged to be able to do that.
Yeah, for sure. But I mean, you found something that works for you. And I mean, I think a lot of people are like, oh, you're PT, like you need to be strong, you need to be active. But there's there's a lot more that you might not see as a
Mhm.
PT that, we've worked in clinics where if you have POTS and we can barely get a sip of water in a 2 hour span, barely eat a snack. I know for me, I've had to like run to the bathroom to eat snacks in outpatient clinics because
I know.
it's so demanding. That would be a nightmare for your POTS. I can't even imagine.
Yeah, it was truly, it was an experience. And I was working at an outpatient clinic, and, we were somewhat understaffed, and, I it really was a situation where I was like go 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 for, 8 to 10 hours straight, and with, short breaks, but it just I think that one of the major things for me is like just accepting that um I don't have to hold myself to the standard of like what society tells you should be doing and you have to be doing. Um, and that is really freeing because ultimately this world is just not made for people who are chronically ill. Um, I think that oftentimes in life and also in the running community, we talk about, healthy runners, and we talk about runners living with disabilities, but there's this whole population of runners living with chronic illness who fall into this kind of in between category where we're not necessarily, some of us are, identify as disabled, but there's a lot of us that more identify with the term dynamic disability, where you're experiencing a lot of fluctuations. So, some days I'm deadlifting my body weight, and other days I can't get out of bed. And that is really the reality of, living with chronic illness.
Wow. Yeah. Thank you for sharing that. I mean, it's probably so nice if you're a runner with a chronic illness and there's a PT and run coach who's telling you, like, it's going to be okay. Like, this is, you know, I can help you. And like every day is going to be different. So, when it came to your running journey, you said you went to the doctor around age 17, diagnosed about a year or two ago. How old are you now? So how many years has it been since the
I'll be
diagnosis?
28 next month. So I had the chronic migraine diagnosis when I was 17, and then the EDS diagnosis when I was 25, 26. So it's been, you know, I'm not necessarily a stranger to health issues, but it has definitely been a major lifestyle change for me in the last couple of years.
Yeah, I'm sure. So when did your running journey start?
Yeah, that's a great question. So I was actually 9 when I ran my first 5K. Uh,
Oh,
yeah,
cool.
so I've been a runner, forever, and I ran cross country all through, middle school, high school. And then when I was a senior in high school when my chronic migraine started. So I did not end up running in college. I might have if I didn't start developing migraine, but it just wasn't feasible for me. It was, I was having near constant migraine, so it just wasn't in the cards. And I think that was difficult. I have a twin sister who also runs, and she ran in college too. So I was able to kind of live vicariously a little bit. Um, so, and then, after I kind of started getting things managed with that and my health was in a better place, I started running again. I did, a few half marathons through college and things like that. Really just enjoyed it as a part of my normal routine, really identified as a runner, is, a part of, who I am. And, then graduating and starting my career, within like my first year or so of my career, I'm, experiencing chronic illness, tenfold. And, again, my running takes a hit. It was actually, I, the first time I got COVID, I was training for a half marathon, and it was in the spring when everything like started. So no one really even knew what it was. And that's really, after that, it was just, running just kind of took a huge hit. So since then, it's really been fairly on and off for me. I've done a couple like races here and there just for fun, but this past year has been really trying. I mean, I was at a place last summer where I was able to be running, and I was doing run walks, and things were great. And then I experienced a flare of symptoms that has been kind of on and off for quite some time. This year was really busy and had some stressors, and I experienced really like low points with my mental health. And now that I'm, kind of at a point where I'm feeling like I have some more answers with my health, I've tried a lot of different like medications and treatments. Um, and I'm finally at a point where I am on a walking plan, and I'm, able to walk for 30 minutes and, feel good. So I'm kind of on that path to return to running. As long as I, stay in my energy envelope and, gradually progress as I'm able to tolerate more, I am on that path, but also acknowledging that it's a dial, and it fluctuates, and it's not necessarily going to be, okay, I'm back to running now. There's going to be points where, I'm not running and I'm running more or running less. And I think, accepting that my running journey looks different than it has previously, and it will look different than people around me too, is really important, because accepting the reality of your situation doesn't mean that you're giving in. It just means that you're, working with yourself instead of against yourself.
I love that. And that's true for anyone. I mean, it really is. If you have a chronic illness, if you're, training in zone 2, if you're doing a walk jog, it that matters for every single person, because it would be so easy for you to compare yourself to others on social media. You're like, you know, I used to be able to do that, and all these thoughts can come back, but then you're working against yourself. And that's a huge mindset shift that every runner can take with them. I mean, it really doesn't matter what you're training for, what you're working on, but work with your body. That's going to allow you to hit your goals, whatever your goals are. It's going to allow you to hit your goals faster.
Absolutely. And I think that there's a level of maturity that comes with, arriving at that conclusion. We can't force fitness. You can't just, um, sit down and say, like, okay, I'm going to follow this training plan that's going to get me to this time, and then just do it and have that happen. I mean, in the beginning of running journeys, maybe you can make big leaps and bounds like that. But I think so many of us would benefit from self-reflection and, taking a look at like where is my fitness at right now? What am I capable of? And what meets me where I'm at, and works through to get me to where I want to be, without a hard timeline, allowing my body to progress as it does. And, all of those things really surmount to a more successful training plan, and less burnout, less injury. If we're constantly overreaching, we're always going to be holding ourselves back. So,
Yeah, definitely. So if you're the type of runner that, me talking to listeners, if you're the type of runner who is like, I just want to hit this, like, let's say a sub 2 half.
mhm.
It's like, okay, well, where did that number come from? Is that just because it's all over social media? I mean, a good question I like to ask, even myself, is if social media didn't exist, would I still want this goal? And would I still have the same goal? Because it can't just be this thing we like come up with,
Mhm.
magically. It's like we have to almost like reverse engineer our goals and make sure they can fit into our lifestyle, make sure they're actually reasonable
Mhm.
goals and things that you want. You don't just want to hit them because you think you have to hit them too.
Absolutely. And this is something I do a lot. Like I talk a lot with my clients about as well. You know, especially living with chronic illness, you have to be, really you have to be really conscious of how you're expending your energy and where you're placing that energy. And, if you're someone who's coming to me saying, like, okay, I want to train for this marathon, but I'm also working overtime. I also, am at a place where my symptoms are not well controlled. I don't have a good sleep schedule. Like all of these things stacking up, sometimes it's important to just, take a step back and say, like, okay, are we at a point in time where this makes sense for you and your health and for you and your life? Because, you know, it is really important to take all of those things into consideration, our work stress, our life stress, lack of sleep, all of those things, they compound um, into our, cup. And when that cup runneth over, then, we're not recovering from the exercise that we're doing. And if you're not recovering from your running, it's not good for you. It's just not.
Mm-hmm. Yes, exactly. I mean, if you think about like someone who is living with POTS or ED and they're on their running journey and every day is different, it is, that's very similar to anyone else's running journey where every day is going to be different. But maybe with ED and POTS, you have more extreme symptoms where you really have to be flexible and really have to adjust and think, how am I feeling? What are my energy levels at? I think that's something that, everyone should really ask themselves because we like to expend a ton of energy and waste our time
Oh yeah.
expending energy doing things that we probably shouldn't be doing. But like for your journey, when you were running and you were in a place where you were running, was it something where you would wake up and say like this is going to be a good day or this is going to be a bad day, or was it something where you're like I just have to see how I feel like after breakfast, or you know
That's such a good question. And I think for a while, I really was kind of just going day to day. But ultimately, that wasn't necessarily the best plan for me. I think having some semblance of structure is important. Uh, so typically for me, my goals would be like, okay, this week I want to get in, 2 runs and I want to get in 2 strength training sessions. So I'll kind of, play out in my mind like, okay, the plan is to, maybe run Monday,